Hi, I'm Marcy, and I will be your tour guide through our virtual tour of the Jamaica Hospital mother-baby units. During the tour, we will take you through various places you and your newborn will be cared for leading up to, during, and after your delivery. We also will meet a few members of our team who will explain to you all the service and amenities that we have here to offer. At Jamaica Hospital, we offer live and in-person tours to anyone who is interested. We also understand that not everyone has the time or the ability to come to us, so we thought that we would bring the tour to you virtually. So here we are in our main lobby of the hospital. If you go into labor during our normal visiting hours, you should come here where one of our team members can take you to the second floor where one of our members will evaluate you. If, however, you go into labor after visiting hours, our main lobby is closed. You should go through the ER walk-in entrance where one of our greeters will provide the same expedited service and take you straight to the second floor. Now, before you get to the hospital, it is important that you prepare with some essential items. If you're unsure as to what to bring to the hospital, I would like to offer you some tips. It is important that you bring what you would normally bring to any doctor's appointment. This can include a photo ID, insurance card. You should also bring appropriate attire for you and your baby. This should include a nightgown and a robe for yourself, as well as appropriate seasonal clothing for you and your baby on the day of discharge. You might want to bring some cosmetic items such as hairbrush, hair ties, lotions, and a lip balm. Don't forget to bring your cell phone and your phone charger to communicate with your family and friends during your stay. You should also pack some toiletry items including toothbrush, toothpaste, shampoo, conditioner, bath gel, and hygienic towels. If you happen to forget any of these following items, Jamaica Hospital will provide the generic versions. Lastly, we encourage you to bring a breast pump if you plan on breastfeeding. You will also need a correctly installed car seat in any vehicle that you are taking your newborn home in. This is very important as we will not discharge your baby without one. You should pack your items in your hospital bag and make sure you leave it near your front door, so you don't forget to bring anything with you. As a reminder, young children are not permitted to accompany you on the labor and delivery unit. We do recommend that you make childcare arrangements prior to delivery. Of course, siblings can visit once you are in the postpartum mother-baby unit. We are now here on the second floor where we offer all of our maternity services. Here with me is Dr. Janice Crystal Asensio, who is the acting chairperson of the Department of Obstetrics and Gynecology, as well as the director of the Ambulatory Women's Health Centers. Hello, Dr. Asensio.
Hello, Marcy.
Dr. Asensio, can you tell us a little bit what makes our team here special at Jamaica Hospital?
I believe what makes this team so special is the diversity. Our team is highly reflective of the community. So that we don't only have very dedicated staff, well-trained. When we look at the way that they engage with our patients, it's passion and care and support. And I think that is what distinguishes us in this community.
What would you say are some of the things that separate us apart from all the other hospitals around us?
I think, again, it is our team. We have a great dedicated team of midwives. We have doula care support. We have physician assistants and nurse practitioners also a part of this team. Our nursing care providers, also from the community, offer a great deal of expertise in their field. Most of them trained with extra certifications just for maternity care and support. It's not only the people being trained, but it's the care and passion they have for caring for this community.
So, Dr. Asensio, why should a patient deliver here at Jamaica Hospital?
Marcy, I'm glad you asked that question. Not only do we have staff who are dedicated and well-trained, but we have had measures from outside agencies which have given us accolades based on our outcomes. We have been measured and we have not been found wanting. So if you want a place where your voice is heard, if you want a place where you'll be safe and have equitable care, a place where we know how to take care of high acuity patients, you should come to Jamaica Hospital.
We are here on the Labor and Delivery Recovery Unit. We are here with Monica, who is our clinical manager for this unit. Monica, what is something you can tell us about the LDR unit?
So the Labor Delivery Recovery Unit, or LDR for short, was created for our patients' comfort in mind. We have a 6-bedded OB triage unit, as well as 12 LDR suites, 3 operating rooms for our C-section patients, and a 4-bedded post-operative recovery area. We have a great team here who are dedicated to providing the highest quality patient care.
When the patient arrives onto this unit, what do they usually expect first?
So our patients that are typically 14 weeks or more are the ones that we see in our labor and delivery area. This is where they get thoroughly examined and a decision is made if they should be admitted to our labor and delivery suite or not.
What's the experience like for those patients who are admitted into one of the LDR suites?
Our goal is to provide a home-like environment for our patients that focuses on comfort and safety. Our suites were created with the comfort of home and feature a wide variety of amenities, including a television, telephone, private bathroom, recliner, and a rocking chair. We also provide wireless fetal monitors and even birthing balls for those patients who desire a more natural approach to birth. These rooms are very spacious, allowing ample room for a support person, which we strongly encourage. In addition to providing a home-like atmosphere, these rooms are extremely functional. Tucked away behind the cabinetry, you will find everything needed to quickly convert the space into a full-service delivery suite.
Monica, how long can patients normally stay here in the LDR suites?
Usually, Marcy, our patients stay for the whole entire birthing process and a few hours after that, after which they get moved to our newly renovated postpartum unit.
I know you gave us insight on how the process is for mothers if they were to have a vaginal birth in one of our LDR suites. What is the process if the mother was to have a C-section?
Great question. So typically for our planned C-sections, they're roomed into our OB triage area where pre-procedure preparations are done. And from there, they are moved to one of our operating rooms. For unplanned C-sections, they are typically moved from the LDR suite to the operating room.
Before we go, can you tell us a little bit more about our LDR team?
We have a great team that consists of obstetricians, OB residents, anesthesiologists, neonatologists, nurses, and support staff. We also have a great midwifery team that offer full scope midwifery service. To complement this service, we also offer doula care through the Community Doula Initiative. We also have a phenomenal lactation team that follows our patients from the prenatal setting through the postpartum period.
We are now down the hall from our L&D unit. Here in front of me, we have Ronnie, who is our clinical nurse manager for our mother-baby postpartum care unit.
So welcome to the mother-baby unit. Here we are a 23-bed unit with private rooms, and we are in one of them right now. In the room, we have a lot of amenities for the family. One of them includes the sofa sleeper for the support person of mom. We have our new bassinets for the baby, which is easy for mom to grab the baby. It twists, it turns, it goes up and down. We have a private bathroom for the family. We have dual TVs, one for the support person and one for mom.
Now that the mother is in the room, what accommodations can be offered for her to optimize her bonding time with her baby?
So we are a baby-friendly designated hospital, which means that we do encourage rooming in for mom and baby. We also have a very supportive staff that will assist the mother with her needs, whatever it may be. Rooming in does help the new mom bond with her newborn, get familiar with feeding cues, and familiar with the life changes ahead of her.
When the mom is here recovering on our mother-baby unit, what are the visitation hours?
Oh, great question. So mom has one designated support person that can be with her through her entire journey up until mother-baby. They have a special band that's provided to them after the delivery of the newborn, which is pink, and it gives them access to in and out of the hospital 24/7. The visiting hours for everyone else would be 9 a.m. to 8 p.m. and they can have up to 2 visitors at a time.
So it's really great to learn about the visitation hours that we have here to offer. Also, what happens when the mother has a baby who is premature or has any complications? What are the accommodations that we provide to them?
So we do have a level 3 NICU. It's located at the front of the mother-baby unit, right in front of the nurse's station, where moms have ample opportunities to go and visit baby. Their visiting hours are 24/7 except for 7 a.m. to 8:30 a.m. in the morning, as well as 7:30 p.m. to 8:30 p.m. in the evening. That's when the nurses change shift. A level 3 NICU is a designation, which means that we are organized with personnel and equipment to provide continuous life support and comprehensive support for extremely high-risk newborn infants, ranging in babies who weigh less than 3 pounds and babies who are born at 23 weeks of life and up.
It's really great to know that we have a level 3 NICU here for our mothers. Is there any final thoughts that you'd like to share about our mother-baby unit?
Yes, we have a team of nurses that are dedicated to support the family during this journey. When the newborn is delivered, we apply a safety infant device on the newborn's ankle, which will lock the unit if the newborn gets close to any of the doors. It's called the HUGS system band. We also offer some special food accommodations such as kosher, halal, and vegetarian options. Some additional services that we do offer as well are lactation consultants that will work throughout the entire day, and we also offer circumcisions for families that would prefer that. So we are here to ensure that you have a positive experience as well as a comfortable one for the entire family, and we hope that you join our family with your new family here at Jamaica Hospital.
During your stay here in the mother-baby unit, you will have the opportunity to meet our lactation consultants who will help guide and support you throughout your breastfeeding, chest feeding journey here with your newborn baby. Here in front of me, I have Paula, who is our lactation consultant, who will help guide you through your process.
Thank you, Marcy. Shortly after birth, one of the lactation consultants will come and visit you and your baby. We will assess the baby's health, your health, help you with positioning the baby onto the breast, and any other concerns you may have.
So Paula, I know that we are a baby-friendly designated hospital. What does that mean, and what is the benefits for a mother to deliver in a hospital like ours?
As a designated baby-friendly USA hospital, Jamaica upholds breastfeeding, chest feeding, and maternal care guidelines established by the World Health Organization and UNICEF. We support breastfeeding, chest feeding because evidence shows that human milk provides the best nutrition for babies while also providing protection from viruses and bacteria.
How else can a lactation consultant assist a birthing parent?
So not only we can help you with the positioning and latch of the baby, if for some reason the baby has to end up going into the NICU, we can also assist with helping the baby latch in the NICU and any other breastfeeding concerns you will have in there. If you're separated from the baby or having any difficulties with latching, we can assist you with pumping, helping to express your breast milk and give your baby the best.
So I know that you mentioned breast pumps. Is that something that we offer to our patients here on this unit?
Yes, we do. We actually encourage you to bring the breast pump if your provider ordered it prenatally, and then there we can have the lactation department show you how to use your breast pump. If that didn't happen, we can order a breast pump for you so you can take it home, or we have our own on the unit.
Are mothers able to receive breastfeeding, chest feeding support even after discharge?
Absolutely. Upon discharge, the nurse will review our breastfeeding, chest feeding resources. You can attend one of our breastfeeding support groups. You can come to one of our clinics where we have drop-in clinics to see the lactation consultant. You are be able to call our breastfeeding warm line, or we have a local WIC office that has a lactation consultant that can go over any of your breastfeeding concerns.
So once our doctors have determined that you and your baby are ready to go home and be discharged from our hospital, there are a few things that you will need to go over to ensure that you have a smooth and safe transition. Before you go home, a nurse from our team will provide information and instructions for your continued care and recovery. Here with me is our assistant nurse manager who will help guide us with the information that we need to receive during the discharge process.
There is some important information that we review with our moms before they bring the baby home. We have to make sure the car seat is available. The birth certificate applications. Upon admission, the patient will receive the birth certificate application that they need to complete and submit it to the birth register or give it to their nurse before they discharge. Items at home to keep the baby's environment safe, such as crib and bassinet. We also review information to help us to schedule follow-up appointment for the newborn babies and the personal appointments.
Do we also provide information on what the mother should expect on the first few days of being home after discharge?
Yes, we provide information on potential complications and warning signs that they should look out for, when to call 911 or go to emergency room, what to do if they encounter feeding challenges.
Do we also provide extra educational materials that the mothers can take home with them?
Yes, we provide educational booklet for patients to go home with. That includes topics such as preventing shaking baby syndrome, SIDS, safety sleeping tips, and most importantly, we talk about the postpartum depression. We want to ensure that our moms coping well with the mental health challenges that they may encounter. We will also provide the discharge paperwork for you to go home, which will include all the follow-up appointments for your baby, your personal appointment, and the phone number for the private physician. The discharge paper includes the pharmacy information and medication you're going home with.
So Violet, I know that we provide gifts for our moms upon discharge. Can you give me more information on the gift?
Yes, we do. We provide this special gift for our mothers who delivered at our hospital. This is our special way to say thank you for choosing Jamaica Hospital. This bag is filled with extra diapers, wipes, and even sleep sack.
Do we provide additional support after discharge?
Yes, we provide information about the WIC program, breastfeeding, chest feeding classes, 10 days telehealth well mom check-in. We know discharge process can be very overwhelming. We want our patients to know we are there for them
every step of the way. So that concludes the virtual tour of Jamaica Hospital's mother-baby units. I hope you found this video to be very educational. If you would like further information or to schedule an in-person tour, please contact us using the information on the screen. Thank you.